So I went to medical school, University of Massachusetts, which is in Worcester, med school, and then I was there for 4 years. And then I went to residency at Hartford Hospital, University of Connecticut, so I was there for 5 years. And then after that, I spent 1 more year in Boston at New England Baptist, specializing in joint replacement. I kind of realized as I got into medicine that I kind of went into it to fix things, and that medicine wasn't always about that, like with hypertension or diabetes, you manage those things. Total joints seemed to me like the most tangible, immediate way of fixing something with a high likelihood of success. So that was kind of why I gravitated to that. 2/3 to 70% of my practice is hip and knee arthritis, which we're seeing now in a lot younger patients than we used to, people from age 40 right up until in their 90s. I also do a fair number of knee arthroscopies for meniscus tears and other people with various knee injuries. The biggest thing, maybe the last 3 years, is anterior hip replacement, where it's less invasive. We make an incision on the front of the leg and we go through the front, almost under where your front pocket is. And you can do a hip replacement that way without cutting any muscle. So there's several of us in the group that have learned how to do it, and we've had some really good results with it. It's a hot area. A lot of patients now researching it, coming in, asking questions about it. And there's definitely pros and cons to it, but it's exciting to see how incredibly easy the recovery is for some patients. It is truly amazing. Very good group. We have very little turnover. We got a lot of people that have worked for us for a long time. People that have roots in Manchester and Nashville, which are our 2 main cities. And I think a great group as far as morale and working together. I think that we have great experience. We have a large number of doctors. We have great resources as a result of that. If the person you're seeing is not an expert in the problem that you have, it's quite possible that the expert might be right down the hall. And we do a good job of making sure that patients get to whoever they need to see with expertise in a particular area.